I take very good care of myself as a physician, because if I don't take care of myself, I can't serve anyone. Unfortunately, not only did I contract COVID-19, but I also contracted type B flu. We can retrospectively look back again as armchair quarterbacks, so we can complain about how our government handled this. We can complain about our governors, we can complain about our president, our Congress, our local officials for not putting in face mask mandates. We can even complain about our healthcare workers. But it's not effective for us to retrospectively look back at this point. We have to move forward on this disease. If we don't, we're going to achieve numbers of deaths through not being vaccinated that are insurmountable for families. It is extremely important that we trust our surgeon generals, that we trust our physicians, the group of well-respected virologists, the group of well-respected vaccinologists who worked so hard on getting an amazing turnaround on a vaccine to treat COVID-19. Work with your physician about vaccines. We hear a lot about herd immunity. The only safe way to get to herd immunity is through vaccination. Just because you're 65 years old and you have COPD doesn't mean you deserve to die. Just because you're 72 and you live in a nursing home and you have medical problems doesn't mean you deserve to die this year. Just because we have a pandemic. We've had patients, one specific, who was in their 40s, who was on ECMO for weeks. He survived. We've had patients lose limbs. The things that we're not talking about in this, there's disabilities associated with this post-COVID. So if you don't have symptoms today, you don't know what your symptoms are going to be 10 years from now. When a patient comes in with COVID-19 and you read that the CDC says, well, only 6% of them don't have comorbid conditions, that doesn't mean that only 6% died of COVID. That's, I'll just say incorrect. Because my patients who have died of COVID would not be dead today. I think what's happened in our nation is fear and misunderstanding. When all of this started, it was downplayed. Oh, it's fine, it's no worse than the flu. Yes, it is. On a bad year, we'll lose 60,000 people to the flu. On a bad year. This year, we've lost already 300,000 Americans. And I'm telling you, looking at data, 3,000 people died in a day so people could go have Thanksgiving dinner. People are going to go to New Year's parties, and the same surges are going to happen after New Year's. So we need to redouble our focus on mask wearing. And when I say mask wearing, wear the appropriate masks. Wear your masks correctly. Don't wear it under your nose. Don't wear it under your chin. Wear it up on your face. Cover your nose to your chin. Tighten around your face. Make sure you protect your family at least. If you're not worried about other individuals in your community, at least be selfish and take care of yourself. Because by retrospect, if you do that, then you're taking care of everyone else. So I'm here to tell you, this is no joke. This is serious. This is killing people. Mask wearing is a proven effective means of slowing the spread of this virus. In all truthfulness, mask wearing is not going to protect you 100%, especially when your neighbors aren't wearing them. Nothing's going to protect you 100%. Not even these wonderful panacea vaccines that we're having out. As you've seen in the news media, they're about 94.5 to 95% protective. You know, people want to live a normal life. Okay, living a normal life right now is wearing a mask until we can get vaccinated. And if you're not willing to wear a mask, then stay home. There are other nations around the world, like Australia, for example. Their flu season was abated to near zero. They have hardly any infections whatsoever in their country. They're very proud of the fact, and I know a lot of doctors there, and I know a lot of people there. I talk to them all the time. They're very proud of the fact that they were willing to come together as a community. They're very happy that they do have a normal life now. They go out, they still wear their masks just in case. New Zealand is another example. Their infection rate is excruciatingly low. If you look around the world, the numbers are excruciatingly low. We kept our numbers low for a while until people decided to drop their guard. When people decided to drop their guard, infections began to rise, which is exactly what we projected.
I'm Dr. Dawn Barlow. I am the president of the Upper Cumberland Medical Society. I'm an internal medicine physician in Livingston. And I want to take a moment to encourage everyone in the community to wear a mask and to social distance and to make sure you're using proper hygiene. We are seeing an uptick in the number of COVID cases in the Upper Cumberland. We're also seeing an uptick in the number of people who are sick enough to require hospitalizations. And we're seeing our friends, families, family members, neighbors continue to get very sick and die with this disease. We need everyone on board participating with masking, social distancing, and it's so important that every person in the community do their part so that we can get a hold of this infection and get it under control. We are also encouraging, when the vaccine is available, that everyone participate and get vaccinated when the time comes.
Thank you for having me. We know that it's going to be months and months and months before we really have the immunity from these vaccines. They're just not going to work instantly. We're so glad we're having them, and this is something we really need, but we've got to do something in the meantime. And as we've said many, many times, or as I've said many, many times, this is just not really rocket science. Face masks, just very simple face masks. Studies have shown that we can reduce the rate of infection by 80% if we just had universal masks, if people would just cover their face, their nose, and their mouth. The reason why is because this is an airborne virus, and that's the way it's mainly spread. Now, obviously, there's other things that we need to do too, but I'm a big proponent of the mask being the most important thing.
As Dr. Duke said, this is a respiratory virus, and prevention is simple. It's not rocket science. It's simple. Wear a mask and just use basic hand washing. Distance yourself when possible. That's easy. We know that 80% of people roughly who contract this virus will be fine. They'll essentially shake it off, as some of my patients say. But 1 in 5, 20% of people don't. And of those 20%, about a quarter of them are going to get severely ill and be hospitalized. And that is where the problem lies. And we can't predict who. We've said this: prevention is simple. Treatment is complex. But the real complexity here is attitudes. And so in America, when you look at a world map, America is doing the worst of all nations in the world, essentially. And if you look at one characteristic of America, if you ask anybody in this country, what is a characteristic of America, one defining characteristic, and I've done this before over the years, the answer is one word: it's freedom. It's freedom. We want our freedom. We want to be able to do what we want to do when we want to do it. Well, there was a notable scholar and speaker by the name of Os Guinness. He asked the question, does anybody know what the number one enemy of freedom is? And the answer is freedom. And this pandemic is proving it. We are currently our own worst enemy because instead of protecting and loving one another, we are wanting our own freedom to do what we want to do when we want to do it. So I'll come back to the message that we've all stated. Prevention is simple. Please wear a mask.
The message that we're all saying is please, please, everybody, wear a mask when you're with people that don't live in your household. Set an example for everybody. Limit your holiday gatherings to people that live in your household. And we need to ask everybody to do this, please, because we need our healthcare providers. We need people like Dr. Staten. We need all of those ICU beds available for when there's auto accidents or other things that we have short needs for ICU beds.
I think what it comes down to, as an American nation, we need to refocus on unity and protecting one another. And I'm sure everybody out there listening probably will understand this. You love God and you love your neighbor. As we know, suicide rates, drug use, alcohol use, domestic violence, child abuse, all of these things are on the rise during this very stressful time. Please wear your mask now. This is the perfect time. If you've not been wearing a mask, get it out. Get a N95 mask if you can. Get a double cotton mask if you can. Get the best mask you can to fit your face. Protect your neighbors, protect your loved ones, protect your children. We don't know the long-term outcomes to our kids. So love your children, love your neighbors, love your family, and love your nation. This is real. So it's our nation at stake. This is the United States of America. There's nothing we can't do if we do it right and we do it together. Thank you very much for having me to talk today. I really appreciate it.